Despite the testing tents and lines of cars waiting to use them, very little testing is actually getting done. Philadelphia's Department of Health reports a few more than 32,000 people have been tested in total in the city for COVID-19. That's about 2% of Philadelphia's population.
How much of the population do you need to test before you'd be medically comfortable reopening?
Well, the reopening would probably take place in stages, and we may be increasing our testing accessibility in stages. Let me give you some general sense of numbers now, though. We're testing about 1,200 or 1,500 Philadelphia residents per day. I would love to test at least 5,000 per day, maybe 10,000 per day, to feel like we're getting as many people as possible with this infection identified.
This is not just a Philadelphia problem. So far, statewide, Pennsylvania has tested about 162,000 people. New Jersey, 178,000. Delaware, a few more than 16,000. None of these three states have tested even 2% of their populations.
If we're going to be successful, as we're successful in reopening, it's going to depend on the ubiquity of our testing capacity and how many tests we have all over the state. We're increasing that daily.
Today, Pennsylvania Governor Tom Wolf gave an update about Philadelphia's plans by phone.
What we don't have, and I think other states are saying the same thing, is what it takes to actually have the test, the reagents, the swabs, and things like that. So we are going out to the private sector and working through FEMA to get these things, and we continue to do that, and I feel that we're making some progress.
The FDA has approved more than 90 private companies and government agencies to make various COVID-19 testing materials. We traced most of them to Asia, which also needs testing, which siphons much of the supply away from the U.S.
The health department deals with the swabs themselves, what you collect the sample with. And so we've ordered those from the sources we ordinarily order those from, medical supply houses, I imagine. We've ordered, I remember for one of them we ordered 10,000 and we got 500. So that's the example. The companies are rationing these because there's more demand and they can produce.
The few American test makers have had their own production problems. The CDC had to shut down test production because of lab contamination. Another American test maker furloughed 4,000 workers as it tried to scale COVID-19 test production. And a Harvard University study actually suggests that we should be testing by June about 5 million Americans a day. Right now in the United States, we're testing about 1 million every single day. That's the latest in Philadelphia. I'm Mitch, Blacher, NBC10 News.